if you look at the skull, you can consider it like to be a pressure cooker. In the skull, you have a volume of brain, which is constant. You have a volume of fluid within and outside the brain. At any point in time, there is about 40 to 50 ml of fluid circulating within and inside the brain, outside the brain.
Cerebrospinal fluid.
Cerebrospinal. It's like a shock absorber.
Right,
It
right.
kind of regulates.
Waste remover also.
Yeah, it removes a lot of waste and sends it into the bloodstream for purification. That is one thing. And there's amount of blood which is flowing. So it's maintained by a very delicate reflexes. When there is any change to the blood flow, what can happen is the blood pressure is very high. The blood-brain barrier becomes a little porous because of the amount of pressure at which it goes, and fluid can leak from these tight junctions, and it can cause swelling in the brain. When there's very high blood pressure, these individuals can become very dizzy. It's called a hypertensive crisis, and they can have change in their mood. They can have difficulty in talking. They may act disoriented. More than what we see as neurologists and neurosurgeons is the chronic effect of high blood pressure. It can weaken the vessels. These vessels have some sort of a limit to which they can expand and contract. They are less muscular. They are more friable. They are more directly vulnerable to the rate at which the blood flows. And this sudden increase in blood pressure, smoking, anger, these vessels can rupture. You can have a hemorrhagic stroke. It's like a jet of blood. It can go up to 160, 180 millimeters of mercury. It constantly hits the junctions, like the blood vessels will kind of branch into various small. Constantly, when someone hits you again and again, it becomes weak there. And you can have something called aneurysms, which are small balloon-like outpouchings on these vessels. The lining of these, the blood vessels in this part, that is the aneurysms, they become very weak. And for some reason, over a period of months or years, when there is a sudden increase in blood pressure, they can burst and you can have a rupture.
Inside the brain.
Inside the brain. It can present in two ways. It can bleed inside the brain. Okay, it's called an intracerebral bleed. Or it can bleed in that cerebrospinal fluid structure which holds these blood vessels, smaller blood vessels. It is called something called a subarachnoid hemorrhage. And these are kind of very critical bleeds.
Life and death.
Very life-threatening bleeds, yes.